Okay? Because, yeah, exactly, you don't want to get sick, right? We work in an environment. I added on. Okay. So, infection control, because again, we are dealing with an invisible force that we can't see. It's kind of like radiation, except this comes in the forms of microorganisms. These microorganisms can get you sick, they can get you ill, and can also cause death if we don't practice good infection control. So some of the things that we deal with in a medical environment includes that as technologists that we should be concerned with is HIV, including AIDS, also hepatitis down here. Hepatitis is probably more detrimental in our health than HIV because this is more prevalent in the community. So other things include tuberculosis and also antibiotic and antimicrobial resistant organisms. And I hear you guys talking about this all the time, your red tape rooms. Okay, that's the first time I've heard that. You use that at St. Jude's, right? Mm-hmm. Okay, that's the first I ever heard of it. We just call them isolation rooms.
I just looked that up.
Oh, that's not a real term?
No.
Oh, I thought that was a real term.
No.
Oh, okay.
Describing. I couldn't get the words out.
It's a Christian term.
Oh, well, I thought that was real.
No, thank you.
Okay, I was gonna start using that.
Oh, you can still use it. Go ahead.
Okay, so red tape rooms or isolation rooms. Thank you. And so you guys are familiar with MRSA and VRE and things of that nature, right? So whenever you hear those terms, all of a sudden you got a red flag and you freak out. Okay, because those are things that you know are bad and you don't want to catch. So this is why we have infection control. This is just simply review. You guys should be familiar with the term medical asepsis, right? What does medical asepsis mean? Okay, reducing. Okay, reducing what? Okay, exactly. So we're reducing the microorganisms from the environment that can cause these illnesses. Again, specifically, we're talking about pathogens. So medical asepsis is, again, it's a condition of reducing the probability of infectious organisms being transmitted. The fewer organisms the healthcare worker is exposed to, the better the chance of resisting those infections. And this is done through the process of microbial dilution, which is the process of reducing the number of organisms accomplished by certain levels, including keeping your environment clean. Okay? So number one, simple cleanliness, which is proper cleaning, dusting, linen handling, and also hand washing techniques. By the way, do you guys wash your hands often?
Hell yeah.
You do, right? Is that good or bad?
Well, it's bad for your
good
skin.
And bad, right? Because we're trying to get rid of some of the microorganisms that can cause illnesses. But at the same time, what's happening to the dexterity or...
Drying them out.
Yeah, you're drying out your hands. So good hand hygiene is of utmost importance. So you want to keep it clean, but at the same time, first of all, your skin is going to be your number one protection, your barrier against these microorganisms. And if you have a break in that, then you're increasing the chances of getting some type of illness. So how long should you be washing your hands?
20 seconds.
20 seconds. What's 20 seconds? Happy birthday twice. You gonna sing it out loud?
Yes.
Of course.
Why not?
You want to do it out loud?
Yes.
Okay. You should hum it. So by the way, I was in the restroom earlier, and I was using one of the urinals, and another guy was using the other urinal. And I went to wash my hands, and as I'm washing my hands, he just goes out the door. One of our medical students. Yeah, from Psych Tech. I even know what program they're in.
Dirty ass
He just
Psych
looked
Tech.
at me, I looked at him, and went,
What's up?
"What are you doing?"
You gonna wash your hands or what, bro?
But that happens in the hospitals too. Yeah, I see doctors doing it all the time. Doctors don't wash their hands.
You have to remind them.
Exactly. Kristen, weren't you earlier talking about how dirty boys are?
Oh my God.
Okay. Sorry guys. Didn't mean to get you started. But yeah, a lot of us are not conscious. We don't wash your hands and we're just up and about. But this is going to be one of your, your skin is the thing, but medical asepsis, the number one thing that you can do for practicing good medical asepsis is washing your hands. 20 seconds saying happy birthday, okay? Because you are eliminating those microorganisms both mechanically and also using the chemicals, soap. Okay. Now when you're using soap, are you completely eliminating those microorganisms?
Nope.
Okay. Again, you look at the bottle of dial. Does it say 100% elimination of bacteria? 99.9, because there's always going to be that 1% that's the superbug that you can't get rid of. Okay. Level 2 is disinfection. It involves the destruction of pathogens by using chemical materials on inanimate objects. Okay, you should be wiping down your portable machines when you enter the patient's room, when you exit the patient's room. You should be wiping down your table, your x-ray tube, your wall bucky. Again, key phrase here is should. Are you guys doing that?
No.
Okay, sometimes. All right. So what we tell you, what you're supposed to do, and what you actually see in practice could be completely night and day.
Mm-hmm.
All right, so, and you guys know the difference between disinfectants and antiseptics? Okay, antiseptic is used for humans, living objects. You don't call your mouthwash a disinfectant, it's an antiseptic. Okay? All right, surgical asepsis then. Okay, we're taking it up an extra level. Sterilization or surgical asepsis is eliminating as many of the pathogens as possible. I'm sorry, completely eliminating as much of the pathogens and microorganisms as much as possible, but also including their reproductive unit, which are the spores. Okay? If the spores exist, you're not sterilizing. That's still considered disinfection. Okay, so sterilization includes the elimination of the spores. Okay? Any questions here? You guys had an opportunity to open up some sterile packages with Ms. Smith today, right?
Mm-hmm.
Yes.
Okay. So how do you guard and prevent from transmission? First of all, good practice in medical asepsis. Standard precautions. You guys should know standard precautions by now. If you don't, you're in trouble. What's standard precautions?
Gloves.
What?
Everybody's
Treating as everybody as they're gross.
Yeah.
Treating.
That's what I got on.
Treating every individual
recording.
that you come in contact with as if they have some transmittable infectious disease. In other words, you never ever let your guard down. Okay? Yeah, everybody has some kind of disease. What is the minimum requirement for standard precautions?
Gloves.
Gloves, very good. Okay. Hand hygiene. Okay, we talked about washing your hands, also keeping them nice, soft, and supple. Clean work area and also disposal of contaminated waste and material is preventing the transmission of infection. I'm waiting. Okay, sorry.
This is where you interject and say shea butter.
Shea butter.
I say coconut oil.
Or a combination of both.
Antifungal, and it's natural and organic.
And where do you purchase that?
Sprouts.
Sprouts. Okay. You have any coupons?
No, but they always do like 15% off.
Do you have coupons for shea butter?
I do once in a
It has a
while.
lot of chemicals in it.
Huh?
Chemicals.
Yeah, but with shea butter, I mean, it has multi-purpose. You can use it for your hands and you can put it on your bread.
And you put coconut oil in your coffee or cook with it.
Or your damaged hair.
Or massages.
Okay, next slide.
Mm-hmm.
Yep.
Okay. All right. Basic types of acquired infections. This is going to be the most common is nosocomial infection. A nosocomial infection is an infection that you get at the hospital. Okay? It is acquired in the course of a medical care. More specifically, iatrogenic infection is acquired during treatment or therapeutic procedure. So we are all at risk of getting a nosocomial infection. Hospital acquired. So it's not just patients, it's also us, right? Now, is it possible for patients to enter a clinical facility with one diagnosis and during their stay have a different type of disease or infection or sickness? Yeah. And whose fault is that?
Theirs.
Whose fault is that?
The physicians and the
It's us, the clinicians. Okay? Because we should be practicing good medical asepsis, and if we don't, this is how we transmit one type of infection to another. All right, and the other one here is community acquired, and this is an infection that you get outside. So you get sick outside. So if it's outside of a clinical facility, that's community acquired. Okay? So you get sick from your kids, that's community acquired. All right. Any questions here? Hold on, or can I go?
Wait.
Hold on. I always laugh at that cartoon.
Is there a goldfish in his IV?
Mhm.
Oh my God.
Goldfish, and he's smoking a cigarette.
Back in the day.
No, I used to, back in the day, I used to talk to one
No
of,
goldfishing, right?
Not
I used to have a conversation with a senior technologist who said that during like a fluoroscopic procedure, her radiologist would be smoking in the room.
Yeah, why not?
Yeah, this was back in the day.
Light up a cig, doc.
Yeah. All right, are we good now?
Yeah.
All right. So factors that promote nosocomial infections includes the environment, which is the air, the infected individual, contaminant. This is on the side. Just listen up, guys. You guys can just download this. Again, I'm just going to go through this. This is review. You guys should know this already.
It's there.
Okay? So I'm just going to go quickly through this. What? Oh, you want me to stop?
Oh, my mouth is just open.
Oh. Okay, I'll slow down. Okay.
No.
Environment.
It's okay.
But you guys have these slides.
The
Yeah.
slides are the. I have. It's there.
That's just a reference.
Yeah.
Just watch the video and do notes that way.
Okay.
I got your back.
Thank you. Hey, but also listen up, guys. I could not give you my slides,
No,
and you can take notes.
no, we appreciate this.
Okay, that's what I wanted to hear.
Thank you.
Okay. All right. So the environment includes the air, infected individual, contaminated food and drinks, and also hospital personnel. Therapeutic regimen. Drugs are used to treat infections may alter the body's way of defending itself. So we've got the worst case scenario on both ends. You get sick, you go to the hospital, you ask them to give you some, what's the first thing you ask them to do? Give me a shot, give me some antibiotics. Is that always a good thing to do?
Not always.
Because you're not giving your body an opportunity to build its own immunity and defenses against that antigen. And eventually what happens is you're increasing your threshold every single time you ask for antibiotics, right? So you don't want to get too dependent on that. And that's why we have such illnesses such as MRSA and VRE. MRSA is what? What does that stand for?
MRSA.
Methicillin-resistant Staphylococcus aureus. Okay? So MRSA, what's methicillin?
It's an antibiotic.
It's a very strong antibiotic. And if your body's resistant to that, then you hope that you don't succumb to that illness. What's VRE?
Versa.
Or there's Versa, there's Versa, and there's also VRE.
Vancomycin.
Vancomycin. So vancomycin, another very strong antibiotic out there. And if your body's resistant to that,
You're screwed.
again, you hope that your body can recover. All right, so there's your therapeutic regimen. All right, equipment, dirty equipment and instruments. Contamination during a medical procedure. If there is a break in sterile technique in which infectious organisms are introduced, including wound care, invasive procedures where there is a break in the skin or protective membrane, or the use of long-term appliances including PICC lines and urinary catheters. In other words, as long as there is an existence between the outside environment and internal environment, there's always going to be a greater chance of an infection. Okay, so your skin is going to be your #1 line of protection. How many times have I said that? Okay, so social and economic factors that can contribute to somebody getting sick or nosocomial infections. First of all is age. the very young and the very old are not immune, but display a greater chance of them getting sick. Okay, that's obvious to you guys, that right? Hereditary. Some just have good genes. Some are more susceptible to getting sick, while others are very strong in fighting those type of illnesses. Nutrition. Okay, having a poor diet. Again, eat things that are colorful, that are green, that grows on trees, that grows from the ground. Exercise. Lack of quality of physical activity can also contribute to some of these individuals getting sick. Stress. Do we know about stress?
Yes.
Okay. We know a lot about stress. All right, so stress can break down your immune system. Inadequate rest. Personal habits including drugs, alcohol, dangerous sexual practices. Health history.
You're the one who laughed.
If you have diabetes, heart disease, chronic lung problems, and children who haven't been immunized can also contribute to the chances of getting sick. This seems to be a huge controversy right now, right? Immunization. I'm indifferent. I'm just presenting the information. Okay?
Vaccination.
Yeah, vaccination. Inadequate body's defenses, where there's a broken skin from burns and or trauma, surgical and medical intervention, and also therapeutic regimen can all contribute to the breakdown of the body's defenses. Okay?
Mm-hmm.
The bloodstream and the urinary tract are the most common sites for nosocomial infections. These often results from long-term uses of vascular access devices, including PICC lines, dialysis catheters, and also portacaths. Are you guys familiar with those type of catheters now? Okay. Do we know what PICC lines are?
Yes.
Overglorified what?
IVs.
They're overglorified IV lines. Except, they don't stay here. The end of the IV line goes into your right atrium or your superior vena cava, which are the largest veins in your body. Dialysis catheters, and then also retention urinary catheters. Again, as long as the outside is communicating with the inside, there's going to be a great chance of this individual getting some type of infection. Okay. All right. What are portacaths used for? Anybody have an idea?
Injection.
For dialysis.
Injection of what?
Chemotherapy.
Chemotherapy.
That's right.
Dialysis is this one, quick catheter.
Mm-hmm.
Yeah.
Damn, that was
Permacath is like it's a dialysis catheter, but it's implantable. This one is just it's temporary. Okay, but the permacath is actually you have to tunnel it in under the
like a
muscle.
fistula, right?
Yeah, this goes right under the tissue.
Right.
I mean, underneath the skin.
I know
so
my
you're doing
father-in-law
the
has
tunnel.
one. It's like a big old ball in his arm.
Yeah. Okay, so it's kind of the better of the two evils. This is necessary, but also increases the chance of the individual getting sick. So to fight any type of infections with these type of appliances, what do we need to do for our patients? Remember the therapeutic regimen we're talking about? We got to give them antibiotics. Okay? All right. Microorganisms. You guys have these slides?
I do.
Yes. We don't have the pictures, but we have.
But you do have the categories, right? Okay, all right.
Yeah.
Microorganisms that cause infectious disease are known as pathogens, so be familiar with that term, pathogens, because there are good microorganisms, there are bad microorganisms. Microorganisms that cause illness, sickness, including death, that's your pathogens, okay? Characteristics of pathogens includes invasiveness, their ability to infect. Number 2 is pathogenicity, how dangerous or lethal those pathogens are. Number 3 is virulence, is the ability to grow or multiply. And then number 4 is their specificity, which is their attraction and susceptibility of the host. You don't have that
Well,
slide.
we just have one that says microorganisms.
Infectious.
Bacteria, virus, protozoa, and.
Oh, that's coming up. That's coming up, okay? But I'm going to give you guys a chance to write this down right now, so write this down. So characteristics of pathogens includes invasiveness, pathogenicity, virulence, and specificity.
Good? Everybody?
Good? I don't want you yelling at me, so I'm just waiting. Okay. As we said, we also have good microorganisms that are non-harmful. These microorganisms or bacteria, they and other types of organisms can be found throughout our body, and some can be good. You can find them in your normal flora, such as in your digestive tract. So they are normally living in those environments. However, when you relocate them into a different environment, that's when they can become very hostile. So for example, relocation from its normal habitat can cause infection. For example, urinary tract infection. How do we usually get, this is for females, how do we usually get urinary tract infections?
Wiping backwards.
From what?
Yep.
From wiping the opposite way. You're bringing normal bacteria from the GI tract into the urinary tract, and that's how you get a UTI. One example, okay? Overproduction can also be bad. So if you have an overproduction of a certain type of microorganism, it can become toxic and pathogenic. Microorganisms can be found in treatment in sewage and waste, brewing, winemaking, and pickling, yummy yummy, yogurt and cheese, fermentation to produce ethanol and other liquid fuel, and also probiotics. It seems to be another big theme there, right? Mm-hmm. Probiotics. Okay, classification. We got this, right? Okay, so classification, basic classifications of these different types of microorganisms is going to be bacteria, fungus, parasite, and virus.
It's in a different order.
Different order, okay, but it's there.
Yes.
Okay. All right. So bacteria. Bacteria is a single-celled and prokaryotic organism, meaning that it lacks true nucleus and organelles, which are specialized structures within the cell. Genetic material consisting of a single loop of double-stranded DNA is found in the bacteria, and this is why people get sick so quick, and it's highly infectious. It's because they have a high rate of population growth in which the cells divide every 20 minutes. Very aggressive. And this is what we were talking about earlier, that bottle of dial, where it says only 99.9% effective. Well, here's your 0.1%. Some of these bacteria has a protective coating around them that makes them very, very highly resistant. These are called endospores. Endospores. So they are resistant to chemicals and physical agents, and also possibly the external environment. So these are very difficult to kill. The other thing about bacteria is that they can be viable for many years, and they germinate to some type of stimulation or some type of response from the environment. Any questions on bacteria? All right, next one here is fungus. Fungus can be described as either being macroscopic, which includes mushrooms and puffballs, or microscopic in the form of yeast and molds. They are eukaryotic, meaning that they have a nucleus and organelles, and exist in two forms. They can be single-celled like a yeast, or be the filamentous hyphae type like the mold. The filamentous hyphae type is described as a small plant with branches stemming from one stem, and it's at the end of these branches where you find these spores. Now this is how they germinate, and this is how they spread around the environment. So the spores here are the reproductive cells, and they're very lightweight and resistant to drying. And all it takes is a simple wisp of air to relocate the spores into a different environment. It could be feet away, it can be miles away. And this is how they're spread. Okay? Questions here? Parasites. Organisms that live on or in other organisms. I was going to use this punchline again, but I think I've overused it. I was going to say it reminds me of my ex. It still works. Okay. It can be a plant or an animal. Classifications include protozoa and then helminths. A protozoa is a single-celled organism. It is eukaryotic. Compared to a bacteria, they are much larger in size. Compared to a bacteria, they also may have a protective coating around them that makes them highly resistant to their environments. So these are called cysts. Okay. So protozoas can be described by their motility. They move around by a flagella, it's the tail, right? Or cilia, tiny hair-like projections. Yeah, everybody's doing this, tiny hair-like projections. Protozoas may have a parasitic characteristic. Again, they're not, don't get them confused, but they may have a parasitic characteristic in that they are able to ingest food particles and have a simple digestive system. Every time I read that, I think of Pac-Man. Yeah? Okay. Those are protozoas. All right, helminths. Helminths are parasitic worms that usually live in human intestinal tracts. You have your platyhelminths, which are your flatworms, and your acyl helminths, which are your roundworms. This includes your pinworms, tapeworms, and also trichinosis.
Pinworms. Got itchy butt.
Yeah. All right, viruses. Do we know about viruses?
Yes.
It's been a good year for viruses, right? So viruses are simple organisms, neither prokaryotic or eukaryotic. They are obligate. They like to take advantage. They are obligatory. Intracellular, parasitic-like organisms that cannot live outside a living host cell. So what they do is they attach themselves to a cell. They inject their genome, okay? Their genetic information. And it's that genetic information that takes over that cell, and that cell does what that virus wants it to do until it doesn't need it anymore. Again, kind of like my ex. All right, so they attach themselves to the host and cell, injecting their genome. It uses the host cell's organelles and metabolic function to produce new viruses, and then after that, they release themselves and they're done. Okay? This is important up here. So if you guys have the slide highlighted, so viruses carry their own genetic information in the form of either a DNA or RNA, never both. It's always one or the other, never both. All right, any questions? Elements of transmission of infection. The cycle of infection. So, in the transmission of infection, you must have an infectious agent, a reservoir of the infection, an exit portal from the reservoir, a means of transmission, and also a portal of entry into the new host. Now, in practicing medical asepsis, in preventing the transmission of infection, you guys should know this, which is the best way to combat the transmission of infection? Which part of the cycle?
Transmission.
Means of transmission. This is where medical asepsis comes in. Okay, so if we break the cycle, the transmission, okay, will cease. So here's your infectious agent. So the host can either be the sick, the diseased, can be a carrier, or can be the living or the dead. Okay, that's going to be your host. Do we know what a carrier is? Carrier is someone who does have the infection but doesn't demonstrate with the symptoms. Okay? Are we carriers? We're all carriers. We all